Well, I'm Vashku. I'm the Chief Scientific Officer at HSS, and my interests are in cytokines, activation of the immune system, and how this relates to musculoskeletal diseases, particularly in the areas of rheumatology and orthopedics. I think that there are two major areas of concern about orthopedic patients who previously had COVID. And the first one is in the area of blood clotting. So patients after surgery are at risk for higher blood clots, some of which can actually be very dangerous. And COVID predisposes you towards blood clotting. So it's something that we have to be very aware of and to make sure that we can prevent this complication in our orthopedic patients. A second major area of concern is that COVID-19, like many infections, can leave a scar on the immune system, which changes the way patients respond during surgery and also how they can heal. And this will therefore affect surgical outcomes. An important emerging area that hasn't really been featured prominently in the literature is the musculoskeletal complications that patients with COVID can have. And this actually harks back to patients who had the original infection with SARS. And what people can get is weakness, pain, disability, and it's something I think we need to be proactive about and look out for. So HSS has undergone a series of studies to investigate outcomes in orthopedic patients who've had COVID. We've actually supported a whole research program in this. We have funded 9 grants to do this, and I think the major area of interest right now is understanding the predisposition to blood clotting and to make sure that our patients are not at increased risk of blood clots, and if so, that we get on top of this and treat them appropriately. I think that the way that the pandemic has affected the work of the Research Institute is we've taken 2 major areas of interest: understanding how immune cells are activated and how cytokines work in the context of inflammatory and autoimmune diseases. And we've really repurposed a lot of this research to focus on how this virus activates many of the same pathways and how we can use some of the therapeutic strategies that we've been developing for autoimmune diseases and apply them to COVID-19 patients. In terms of my own research, I've been studying cytokines for almost 30 years now, and thinking of new ways that we can inhibit them in rheumatoid arthritis. And 2 examples that we've worked on, which I think are highly relevant for COVID-19, are epigenetic mechanisms that control immune cells and the so-called JAK-STAT pathway, which has now been effectively therapeutically targeted and is there's an approved drug that's a JAK inhibitor that's used to treat RA patients. And what we've been doing in the lab is thinking about ways that we can target these molecular pathways in the response of how cells respond to the COVID-19 virus and how we can use this information to try to develop new treatments for this disease.